Law enforcement interaction with mentally ill individuals. Here we hear Elijah McClain's last words.
Relax, just relax. Relax. All right, bring that arm back. We'll give him a couple.
My name's Elijah McClain.
Yeah, bro. I'm here to use carotid.
That's wild.
The statistics. According to statistics, people with untreated mental illnesses are 16 times more likely to be killed during a police encounter than other civilians approached or stopped by law enforcement. Police are in fact 5 times more likely to shoot and kill unarmed black men than unarmed white men the same age. Police are also more likely to shoot and kill unarmed black men who exhibit signs of mental illness compared to white men with the same behaviors. Crisis Intervention Training. Crisis Intervention Training, also known as CIT, is a community-based intervention program designed to assist people in crisis by addressing their symptoms and teaches how to de-escalate situations. We recommend that CIT be mandated for all police officers, other uniformed employees, and civilian employees. CIT be implemented into the police academy courses. In addition, it should be required for all cadets to pass the training to graduate as a police officer. Okay, so we speak about funding. The City of New York City and the NYPD have already allocated funding for the CIT program. The funding is there. Funding was initiated in 2015. The current mayor wanted all officers on staff to have received the training by 2020. We are now into 2021. $5.3 million a year has been allocated to train the current police officers and uniformed employees on staff since 2015. The yearly funding for the NYPD is $10.9 billion. We propose not to defund the police, but in fact rather reallocate the funding already in place to better support the communities that they protect and serve. So what are the benefits of working together? Well, by implementing social workers to crisis calls, we lead to a safer outcome. For example, if 2 officers and a social worker respond to a call, and all 3 respondents are certified in CIT, it will ensure that mental health crisis calls are handled as safely and correctly as possible. Now, we hope that this will lead to less incidents of people dying or being mistreated while in police custody due to their mental health issues. The more people that are CIT certified that go on these calls, the better the outcome. In other states, it has been shown that when officers are CIT certified, mental health crisis calls are therefore handled better. Aiding in social workers can increase the chances of mental health crisis calls ending more safely for everyone. CIT renewal. We also recommend that an annual CIT renewal and review be done to promote continued fairness and equity for the mentally ill. If planned and implemented accordingly and correctly, requiring the renewal course will create positive community feedback. This proposal aims to provide a safer and more secure environment for individuals and their communities they live in, allowing traumatized individuals to return to their place of origin safely. So, the current status and our positive outcomes. Well, New York City has a pilot program in place in 2 neighborhoods that replaces police first responders with mental health and crisis professionals. such as EMS workers and social workers that are doing these calls. There are to go on calls that are considered nonviolent mental health crisis calls. If while on a call the situation ever becomes violent and dangerous, the first responders are expected to call the police for backup. Training for the EMS teams and social workers will begin immediately. The goal is for the program to eventually expand across this whole city. You see, this change will hopefully bring a sense of support and stabilization to the communities and prevent any further harm being inflicted.